My name is Elizabeth Ryder, and I'm an occupational therapist at Burke Rehabilitation Hospital. Today, we will be discussing tips and techniques to maximize independence and decrease caregiver demands for neurogenic bladder management after spinal cord injury. In this presentation, we are going to review different aspects of neurogenic bladder management. Some of what we will discuss today will include different positions, durable medical equipment, adaptive equipment, and clothing management options. First, we need to discuss different types of catheters, including indwelling, suprapubic, condom, and intermittent catheters. To begin, indwelling is a sterile tube that is inserted through the urethra and remains in the bladder for constant emptying. The catheter attaches to a drainage bag that collects the urine, and it can be attached to either the bed, the person's leg, clothes, or the chair. A suprapubic catheter is inserted surgically through the abdomen directly into the bladder and also provides constant emptying of the bladder around the clock. A condom catheter, used for males only, slips like a condom over the penis. This device has a tube that drains urine into a bag. Depending on the hand dexterity someone does or does not have, you may be assisting in placing the catheter on the penis to ensure it is placed correctly. Self or intermittent catheterization is a lot of what we are going to talk about today. In this case, you're inserting the sterile tube directly into the urethra and then removing it once the bladder is emptied. You do this on regular intervals as prescribed by the physician, typically every couple of hours. In both inpatient and outpatient therapy, we are constantly working on finding positions that will maximize independence and decrease caregiver burden during the catheterization process. We usually will begin in a supported sitting position, often in the bed. We can start with the head of the bed elevated to support the person's back so that their entire focus is on the other demands of catheterization. As that continues to improve, we will often lower the head of the bed and have a person sitting in unsupported long sitting to perform the task in that position. As someone progresses in therapy, we may move from long sitting to the frog position. In the frog position, a person's knees are spread apart, the soles of the feet are touching, and this increases the visualization of the urethra, especially for women performing self-catheterization. As a caregiver, you may be needed to assist the person in positioning their legs into this position. Ultimately, the goal is really to perform this task at the edge of the bed, in a wheelchair, and hopefully over a commode or a toilet, if possible. So those are additional positions we work towards as a person's upright tolerance improves, their balance improves, and they're able to transfer into the wheelchair with a little bit more ease. Performing this task at the wheelchair level can be difficult, especially for women, for the positioning of the legs. So speaking specifically of women, there are certain tools that are created for women because the visualization of the urethra is exceptionally challenging. Some of the equipment includes different adaptive mirrors. Mirrors can come in a form where they stand independently to free the hands up, and you can place it in front of the urethra. They can also attach to the chair or the bed, or there's even ones that strap around the leg to free the hands to perform the catheterization. Visualization of the urethra is typically the hardest part of catheterizing for women, but know that there are options out there. As a caregiver, you may be needed to place the mirror in the optimal position to improve the visual field. There are also devices such as the Asticath, which are created to assist women in locating their urethra. This device is inserted into the vagina with holes that align with the urethra to make locating this opening a little bit easier and more hands-free. There are also objects such as labial spreaders that additionally increase the visualization of the urethra. Sometimes we use transfer boards to be placed behind a person's pelvis to increase the tilt of the pelvis to make it so the urethral visualization is easier. For men, visualization is a little bit easier, but there are still adaptive devices that can make positioning easier. First and foremost is this device called a penis support. This is a small piece of foam that velcros around the base of the penis to hold it in a more optimal position. Sometimes this can be placed by the person themselves, or a person may need assistance from their caregiver to put that in place. Again, this will just make the positioning more optimal for catheterization, especially at the wheelchair level. The handheld urinal also offers a portable option for urine drainage collection at bedside or at the wheelchair level. Some individuals experience upper extremity impairments after spinal cord injury. There are additional adaptive items to ease the process of bladder management that are commercially available. Catheter inserters are great for individuals who do not have the fine motor strength or dexterity to hold the catheter tube. This is a cuff which assists the individual to grasp and thread the tube with an adaptive grip, eliminating the need to hold the tube directly. Often the role of the caregiver is placing this holder on your loved one's hand in order for them to perform the rest of the task independently. A bath mitt is also an option frequently used by persons with decreased hand functioning. The mitt is essentially a washcloth that velcros around the wrist to remain in place. Again, here, the role of the caregiver may be to set this up and place it on the person's hand so that they can then perform the hygiene independently. If you wish to have a more discreet bag and tube when out in the community, you may utilize an opaque bag. An example here is a Burke bag. You can use any bag desired, but note that they do make opaque bags specifically for this purpose with features to hold the tubing. Clothing management is often one of the more challenging task demands of neurogenic bladder management. For easier clothing access, it is best to purchase clothes with elastic waistbands or easy to manipulate fasteners. Sometimes dresses can make bladder management much easier and decrease the demand of clothing management. Shorts are also a good option because they are much easier to manage. If still experiencing incontinence, there are discreet adult briefs that one can wear. This can decrease the level of assistance required in the event of unexpected urinary or bowel incontinence. In addition to purchasing clothing with easy access fasteners or custom-made adaptive options, you can adapt existing clothing with things like rings, bigger buttons, or Velcro to make someone more independent in managing their clothes and therefore more independent in their bladder routine overall. This will decrease the demand on you if assisting in clothing management. You can attach a loop when utilizing a Velcro bag for a leg bag. This allows someone with limited digit movement to manage their drainage bag more independently. Discreet unisex catheter clothing is also available, which are undergarments with pockets sewn into them to conceal tubes and the bag as desired. Clothing hooks assist with pulling the pants down far enough to catheterize. Once in place, you don't have to continue adjusting the pants because it will lock in place. If you are assisting in the clothing management aspect for catheterization and are performing intermittent catheterization at the wheelchair level, this can assist in freeing up your hands by holding the pants in place. The pant hook slides between the seat cushion and the chair bottom and then hooks to the person's waistband. There are different types of catheter packages. When choosing a brand, consider the demands of opening the packages in relation to hand functioning. Many companies now make easy open packaging, and some brands make catheter holders as small as a lipstick container. This is nice for fitting it into a bag or a purse for on-the-go needs. Finally, I want to discuss performing the bladder routine in the community. As mentioned, often intermittent catheterization has to happen every few hours. The goal of spinal cord rehab is to encourage re-engagement in all needed and wanted occupations, and this includes social participation and community engagement. Planning ahead to ensure one is prepared for bladder management in the community is essential for avoiding accidents and/or potential medical emergencies related to an overfilled bladder. For these reasons, if performing intermittent catheterization, we work toward the goal of performing self-catheterization at the wheelchair or toilet level and work on wheelchair mobility to negotiate bathroom stalls in different environments. Planning ahead and preparing goes a long way here, and this is certainly an area where you, as a caregiver, play a pivotal role. We recommend having all items needed for straight catheterization placed in a purse or backpack to ensure you have everything needed when out in the community. To decrease the assistance required for clothing management, we recommend wearing more adaptive or loose-fitting clothing. We want to conserve energy as much as possible for the individual and also for you as a caregiver. Additionally, we want to plan ahead for different hand hygiene requirements. It is important to pack wipes or Purell in the event that a sink is inaccessible. We also recommend packing a collection bag or bottle to bring with you in case a toilet is inaccessible to ensure that you have an option for urine emptying regardless of the environment. In conclusion, the goals of neurogenic bladder management include maximizing independence, decreasing caregiver burden, and promoting community engagement and return to occupations for people post-spinal cord injury. Thank you.